Are you curious about what to expect at your first pelvic floor physical therapy visit? I have a lot of people who come into the clinic and they may have some anxiety, they may have some questions because they're just not sure what pelvic floor physical therapy is. So that's what we're going to talk about today, is what you can expect at the first visit, as well as answering some frequently asked questions so you're prepared for your first pelvic floor physical therapy visit. I'm Dr. Amy, PhD trained orthopedic manual physical therapist, and we are empowering women with changing bodies to move pain-free. First off, let's get over the common fears that are associated with any type of new treatment that you haven't had before. And the primary one that I see is people are wondering, is it going to hurt? Now, during your evaluation, there really shouldn't be any pain that's sustained for a long period of time. So sometimes when you're checking out the body and how it's moving, pain may be reproduced, but then we're going to back off of that. We're just trying to see at that first visit what is, so that we can build on that and create that plan to get you back to your goals. So don't worry. If anything is painful, we'll immediately back off of it. We're not going to push into that pain and try to get through that barrier. That's just not how we do things. We're going to make sure that you feel comfortable the entire time. So feel free to communicate with your physical therapist during the entire appointment to let them know what you're feeling. Now, what should you wear? With pelvic floor physical therapy in particular, we do still want to see how the entire body is moving, because most commonly when you have a pelvic floor dysfunction, it actually comes from somewhere else in your body. So we're going to do a full evaluation looking at your movement patterns, including how your spine and your pelvis are moving. So wear some tighter fitting clothing so that we can see you walk and see how your body is moving. And then to assess the pelvic floor, we'll put some sheets on the table and have you undress from the bottom down. You can go ahead and keep your socks on if you're more comfortable with that. And obviously your top and everything can be kept on during the rest of the session. You'll be draped appropriately with a sheet over you for the rest of the session. So don't worry that you're going to have to walk around naked or anything like that. Should you bring anything in particular to your first pelvic floor physical therapy visit? What I would recommend is, if you have been using any tools or anything so far, I would go ahead and bring those, and that way you can talk to your pelvic floor physical therapist specifically about what you've already tried and if it has or hasn't worked. It could be that that could be a good tool for you, but it hasn't worked thus far and you just need some instruction on how to use it for your body. And it could be that it's a tool that is not recommended for your body and you're not going to want to use it moving forward. One thing in particular that I see a lot in the clinic is when people are having urinary incontinence, which can be a pelvic floor dysfunction. They'll have bought some weights that they insert and then they do Kegel exercises. I do not like those at all, and I do not like what happens to your pelvic floor when you do them. It's okay to go ahead and bring them in, but then we can talk about it and you can actually feel what's happening with your pelvic floor, so that we can understand that probably that's not actually going to be helpful for you. But feel free to bring it in and ask all of your questions about anything that you have used or thought about using. A lot of people are wondering if they'll have pain after the initial evaluation. And the goal is not to see how much pain we can cause you. We want you to feel very comfortable during the session, but also afterwards. Now, sometimes we do get into an area that's particularly painful, and there can be sensations that come up afterwards. And we're definitely going to want to know about that, because that's going to tell us that we need to back off at the next session. But please understand that pain is not the goal. So if you have any pain during your entire evaluation, make sure that you're communicating with your therapist so that they can back off immediately. The next question I get is, what happens after that initial session? So after we've done a full evaluation, we understand the root of your dysfunction, we already have talked about what your goals are, then we're going to give you that plan. You're starting here and you want to get here. So what is that plan that's going to get you from here to here? So we'll discuss what that looks like, including frequency of how often we need to see you and what you can expect along the journey. What I want to assure you is that during that initial evaluation, as well as during every session, you are in control and you get to discuss what feels comfortable for you and what doesn't. A lot of people are really intimidated because they're afraid it's going to be painful, or they're afraid that they can't say anything about what's happening. What we want is your communication, because we're not here to try to cause you pain. I assure you that every pelvic floor physical therapist understands how difficult it is for you to walk into the office in the first place. This is something that a lot of women do not like to talk about. And even coming in for that initial appointment is a huge sign of bravery. So we don't want to reward that bravery with more pain. So please know that our intention is not for you to have pain during the initial evaluation, nor to have pain afterwards. So please do communicate, and we'll be trying to communicate with you as well. When we get to an area that feels tender or feels like it might be sore, usually we will be asking you, is that tenderness? And then we'll back off from that area. But it's really important to communicate with your therapist during the evaluation, but during all of your appointments. Your pelvic floor really is the core of your body. Making sure that your pelvic floor is functioning correctly so that you don't end up having issues that go into your hips or your SI joint or your low back, or even work up to your neck and jaw, is critically important for your overall health, especially as you age. The other thing we know is that muscles are a use it or lose it scenario. So if you're having any pelvic floor dysfunction in your 30s, 40s, or 50s, that means your pelvic floor is not activating correctly. And if it goes years and years without activating correctly, then chances are good when you get into your 60s and 70s, you're going to struggle more with things like constipation, urinary incontinence, and even require things like a total hip replacement. Because again, the pelvic floor is directly linked to the hips, and that's why you usually will start to have pain there first, but it will go all the way up the spine if it doesn't get correctly treated. So I want to encourage you, if you're struggling with any type of pelvic floor dysfunction, and that could be incontinence, peeing when you laugh, cough, or sneeze, having any issues with constipation, even anything like irritable bowel syndrome can actually be a sign of pelvic floor dysfunction. Reach out and get the help that you need now so it doesn't progress and become a bigger problem later on where you end up needing both hips getting replaced. If this video was helpful for you, please give it a thumbs up, and don't forget to hit the subscribe button. If you have questions on what you should be doing instead of Kegel exercises, go ahead and check out this video over here, or download our free guide, which is linked in the description box below.